So people have been using horticulture as a way of promoting health for a very long time. The practice of horticulture has progressed from the 1800s belief that working in an agricultural field could benefit mental patients. In early 1900, we've used gardening as activity and therapy for physical rehabilitation. And then later in 2000, many different types of programmings and settings started to emerge. I think people in general are more aware of nature and are willing to use nature-based approaches. It also became more respectable during the time, and there's been a huge amount of research done in the field with loads of evidence of its serious implications for either our health or well-being. Entities that have influenced horticultural therapy and also continue to shape the profession include practitioners, educators, researchers, professional associations, employers, volunteers, as well as clients and the participants. So let's talk about each of these in more of a depth. Since the mid-1900s, horticultural therapy has been used by mental health professionals, physical rehabilitation specialists, and also vocational service providers, as well as other human service providers. In some settings, horticultural therapists work very closely with professionals to maximize the outcomes and benefits to clients. The profession is shaped by a majority of practitioners who are willing to share information freely and are open to new ideas and approaches. So a good amount of program models are actually a result of creativity and dedication of these professionals. Horticultural therapy education and training programs have helped to produce research, define the profession, and also to establish the standards. Both historically and currently, most educational programs are based in horticulture or plant science departments, either in colleges or universities, or also in horticultural therapy certificate programs. They are seldom found in human science or healthcare facilities. In future, we need more courses with balanced proportion of human services and social science for the therapists wishing to practice in either healthcare or social services. Over the past 50 years, there's been a lot of research done that documents the benefits and outcomes of horticultural therapy. But there is still a strong need for more research as a base of the profession. It is critical for the future funding, employment, and a better practice that practitioners, educators, and also researchers from relevant disciplines team together to carry out and publish research on more social science methods. Different associations and groups have focused on spreading the information through publication, conferences, and networking. In order to advance the practice of horticultural therapy, there should be more of a promotion of the profession to healthcare and human service providers, as well as regulatory and insurance associations. Another important activity is to create and manage a credentialing system. There is a real scarcity of university degrees in horticultural therapy. Currently, it is a voluntary professional registration system which is based on interdisciplinary education and a supervised internship. There are multiple associations around the world, naming just few, like the American Horticultural Therapy Association in US or Thrive in UK, which plan that the future standards will include a certification exam that will be based on job knowledge and the skills. Since the mid-1900s, volunteers have brought gardening to prisons, to hospitals, long-term care and others, usually at no cost. Gardeners especially have been active in developing different programs, utilizing their training and experience in horticulture. Volunteers usually serve at programs led by trained horticultural therapists, and having a healthcare or human services education is not really required. Employers commonly look to supplemental funding bases to operate horticultural therapy programs. Usually it's a private donations of money, materials, labors, income from sales or plant products, and also program grants that help to fund the program. Insurance companies regard horticultural therapy as reimbursable only when they are framed within strict guidelines such as training or treatment. So the people serving horticultural therapy programs play a role in how the programs evolve. There is a trend in client-centered care, and those involved can choose therapies, placements, and pursuits in which to be engaged. As more consumers understand the benefits of using horticulture as a tool for therapy and rehabilitation, they are more likely to choose the organization that actually offers this service. For example, an individual may prefer to live in an assisted living or long-term care facility that has the gardening program as an option for the ongoing activity. And this may actually give the organization a competitive edge and also the motivation to continue or expand the horticultural therapy programming.